For adults over the age of 60, a heart attack is rarely a dramatic movie-style event. In clinical practice, it often begins subtly, quietly, and deceptively. This is precisely why early recognition and immediate action are the most critical factors in survival, particularly when a person is alone. With advancing age, the body's warning systems change. Pain perception may be reduced, symptoms may be atypical, and existing medical conditions such as diabetes, high blood pressure, or nerve damage can blunt the classic signs. As a result, many seniors delay seeking help, mistakenly attributing symptoms to indigestion, fatigue, anxiety, or normal aging. This delay is one of the most dangerous and preventable causes of death related to heart attacks in older adults. A heart attack, medically known as a myocardial infarction, occurs when blood flow to a portion of the heart muscle is suddenly blocked, usually by a blood clot forming over a ruptured plaque in a coronary artery. Once blood flow is interrupted, the heart muscle begins to suffer from oxygen deprivation. Within minutes, cells start to become injured. Within 20 to 30 minutes, irreversible damage can occur. The longer the blockage persists, the greater the amount of heart muscle that dies. This damage cannot be reversed. Modern medicine can restore blood flow, but it cannot resurrect dead heart tissue. This is why time is not simply important, it is everything. In people over 60, symptoms are often less obvious than the classic crushing chest pain widely portrayed in media. While chest pressure or tightness may still occur, it may feel mild, vague, or intermittent rather than severe. Some patients describe it as heaviness, fullness, squeezing, or burning rather than pain. Others experience discomfort in the jaw, neck, shoulders, upper back, or left arm without any chest pain at all. Shortness of breath is a particularly common presentation in seniors and may occur even at rest. Sudden unexplained fatigue, weakness, dizziness, lightheadedness, nausea, cold sweating, or a general sense that something is not right are also frequent warning signs. These symptoms should never be dismissed, especially when they appear suddenly or are out of proportion to activity. One of the greatest clinical dangers is denial. Many older adults hesitate to label their symptoms as a heart attack because they fear being wrong, causing inconvenience, or appearing alarmist. Some wait for symptoms to become unbearable before acting, while others decide to lie down and see if it passes. From a medical standpoint, this hesitation is extremely hazardous. Heart attacks do not improve with rest. Delaying action allows the clot to grow, the artery to remain blocked, and the heart muscle to suffer ongoing injury. Studies consistently show that patients who seek treatment within the first hour of symptom onset, the so-called golden hour, have dramatically better survival rates and long-term outcomes compared to those who delay. For seniors who are alone, the margin for error is even smaller. There is no immediate observer to notice collapse, confusion, or loss of consciousness. If the individual becomes incapacitated, the opportunity to call for help may be lost entirely. This is why the first response to any suspected heart attack symptom must be immediate and decisive. At the very first suspicion, the individual should stop all physical activity and focus on getting emergency medical help. Driving oneself to the hospital is not recommended, as symptoms can worsen suddenly, leading to loss of consciousness or fatal arrhythmias. Emergency medical services are equipped to begin treatment immediately, monitor heart rhythm, provide oxygen, and deliver life-saving interventions en route to the hospital. Remaining calm is also medically important. Panic triggers a surge of stress hormones, such as adrenaline, which increases heart rate and blood pressure, further straining an already compromised heart. While fear is a natural response, slow and controlled breathing can help limit this stress response. Sitting upright or leaning slightly forward with back support can reduce cardiac workload and improve breathing efficiency. Lying flat is often uncomfortable and may worsen shortness of breath, especially in older adults who may already have compromised lung or heart function. If sitting is not possible due to weakness or dizziness, lying on the side with the head elevated is a reasonable alternative. Loosening tight clothing is a simple but medically sound step. Tight collars, belts, or restrictive garments can interfere with breathing and increase anxiety levels. Anxiety triggers the release of stress hormones such as adrenaline, which increases heart rate and blood pressure, further straining an already compromised heart. By making breathing easier and reducing physical restriction, the body is better able to maintain oxygen levels and remain calm.
Hello there. Come on
Controlled
in.
breathing is another
so good to
crucial
see
stabilizing measure. Rapid, shallow breathing is common during pain or panic, but it reduces oxygen efficiency and can lead to dizziness or fainting. Slow, deep breathing helps improve oxygen exchange in the lungs and lowers sympathetic nervous system activity. Clinically, this reduces heart rate and blood pressure, easing cardiac workload. Patients should be encouraged to inhale slowly through the nose and exhale gently through the mouth, focusing on maintaining a steady rhythm rather than taking forceful breaths. If aspirin has been previously prescribed or recommended by a physician for heart health, and there is no known allergy or contraindication, chewing one standard dose tablet may be beneficial. Aspirin works by inhibiting platelet aggregation, which can slow the growth of a blood clot blocking a coronary artery. Chewing the tablet allows for faster absorption compared to swallowing it whole. It is important to emphasize that aspirin is not a cure for a heart attack and should never delay calling emergency services. However, in the appropriate patient, it can modestly improve outcomes while awaiting advanced care. It is equally important to avoid certain actions that can worsen the situation. Alcohol, food, or unnecessary medications should not be consumed during a suspected heart attack. Eating diverts blood flow to the digestive system and increases cardiac workload. Alcohol can lower blood pressure unpredictably and interfere with emergency medications. Taking unprescribed drugs or painkillers may mask symptoms or cause harmful interactions. From a medical standpoint, simplicity and caution are best during this period. Staying conscious and alert is another key objective. Loss of consciousness can indicate dangerous heart rhythm disturbances, which are common during heart attacks, especially in older adults. Remaining mentally engaged by focusing on breathing, keeping eyes open, and responding to sounds may help delay fainting. While this does not prevent arrhythmias, it can buy time until help arrives and reduce the risk of unnoticed collapse when alone. Monitoring symptoms without panic is also important. Worsening chest pain, increasing shortness of breath, confusion, or sudden weakness should be mentally noted and, if possible, communicated to emergency responders. This information helps medical teams prepare appropriate interventions. Seniors should not feel embarrassed or fearful about reporting their symptoms. Accuracy can save valuable time in treatment decisions.
It's all right, they're here now.
Another often overlooked aspect of stabilization is environmental preparation. If physically able, unlocking the door and turning on the lights can help emergency personnel reach the patient quickly. Delays in access can be dangerous, especially if rapid intervention is needed. Keeping the phone on speaker mode allows the patient to remain hands-free and conserve energy while staying connected to help. These small actions can have a meaningful impact on response efficiency. From a physician's perspective, many deaths during heart attacks do not occur solely because of the blockage itself, but because of complications such as sudden arrhythmias, severe drops in blood pressure, or respiratory distress. The steps described above, proper positioning, controlled breathing, stress reduction, and minimal movement, are designed to reduce the likelihood of these complications. They do not eliminate risk, but they significantly improve the body's ability to cope during a medical emergency. It is also important to address a common misconception, coughing forcefully to restart the heart. While this idea circulates widely online, it is not a reliable or recommended technique for individuals experiencing a heart attack outside of a monitored hospital setting. Unsupervised coughing can increase chest pressure, worsen pain, and cause exhaustion.
Medical professionals do not advise this method for seniors at home. Calm, controlled measures are safer and more effective. In summary, when a heart attack occurs in someone over 60 who is alone, the period between calling for help and the arrival of emergency services is critical. During this time, the focus must be on supporting oxygen delivery, reducing cardiac workload, maintaining consciousness, and preventing panic. Sitting upright, loosening clothing, breathing slowly, using aspirin when appropriate, and avoiding unnecessary movement are evidence-based steps that can stabilize the condition. These actions do not replace medical treatment, but they can slow progression, reduce complications, and significantly improve the chances of survival. From a medical standpoint, early recognition is not merely advice, it is a life-saving obligation.